Okay, how else can we either increase or decrease contrast with things that maybe we can adjust or change? So we have grids. Grids are going to improve your image contrast. That's really their main purpose of why we want to use one in the first place. They have those lead lines in them that are going to absorb the scatter radiation. Essentially, they're a blocker for your image receptor. They're going to take on some of that scatter radiation before it hits your image receptor, and that's why it's going to improve your contrast. A higher grid ratio is going to improve your contrast more because it has more lead lines. So a 12:1 is going to be more efficient than, say, a 5:1. Right, more lines. But higher grid ratio, higher patient dose, right? Higher grid ratio, I have to use more mass. So we're going to play with that a little bit. And just remember, grids do not reduce the production of scatter, right? Because where does scatter happen? At the patient. Where's your grid? Behind the patient. They will absorb some scatter. They do not reduce the production, right? OID. When would we use a big OID? The air gap technique is a technique that you can use in place of a grid. So if you don't have a grid and you need to do an exam that normally requires one, you could use the air gap technique where we on purpose bring the image receptor farther away than normal. This gap, or this space, actually allows for the scatter photons to scatter before reaching the image receptor. So ideally, anytime you have less scatter reaching your image receptor, you're going to improve your contrast. Filtration. Increasing filtration is similar. It's a similar concept to increasing KVP, for me to remember that, right? Do we as technologists adjust filtration? No, we don't. But increasing filtration removes more of the low energy photons. It makes that beam, or that average energy of the beam, increased, right? So I always remember that when I increase my KVP, I increase my energy, I decrease my contrast. It's the same really for filtration, so if you can put those two together. So increasing filtration actually decreases your contrast. Collimation. Collimation can help me improve my contrast because when I collimate in and make a smaller field of view, there could be less scatter production, less scatter, less, better contrast. And also, my collimated borders are what allows that amount of radiation to reach my image receptor. If I have a smaller field, less scatter is reaching my image receptor as well. So all of those things can either increase or decrease our subject contrast, remember, not our digital contrast. Body habitus can also be involved with a contrast question, right? Because if we think of body habitus, we think large patients, if they have more mass or more matter, there's a higher chance of scattering. So scatter, we don't like scatter. We don't like scatter really for any reason. It makes my image more gray. It increases my dose as a technologist. Scatter, bad news bears, right? But if you're asked a body habitus question, I want you to think about kind of what they're really asking you. They're asking you about, say, an abdomen on a hypersthenic patient versus an abdomen on an asthenic patient. What does the hypersthenic patient have more of? They have more body weight. They have more soft tissue. More mass or more matter is going to scatter more. So your larger patient or hypersthenic patient most likely will result in a more low contrast image versus your asthenic patient or slender patient, maybe a higher contrast image. So body habitus is definitely a term I would watch out for on those questions.